Good afternoon. Thank you all for joining us today. My name is Zach Petkanis. I'm the director of Protect Our Care's Coronavirus War Room. I am very pleased to be joined by a panel of very distinguished guests. We have former Health and Human Services Secretary Kathleen Sebelius. We have former Veterans Affairs Secretary David Shulkin. And we have Leslie Dach, who is chair of Protect Our Care, a former senior HHS official, and someone who was tasked with heading up the HHS transition team for Hillary Clinton in 2016. Here's where we are right now. Joe Biden has won the election. He won it last Tuesday with more votes than any president in the history of the United States of America. And as a reward, he has inherited a coronavirus crisis that has gotten completely out of control, and it's getting worse. Just going to run through a few stats of where we are right now. The US leads the world with nearly 240,000 deaths. We're the first country in the world to surpass 10 million cases. The US is adding approximately 100,000 new cases every day. 1 in 441 Americans have tested positive for the virus in the last week. The 7-day average for COVID-19 deaths is up 36% over the last 3 weeks. Coronavirus hospitalizations have hit their highest level since mid-August. And experts are suggesting that by Biden's inauguration day, we will hit 400,000 American deaths. This is a national emergency that is going to be incredibly difficult for the Biden administration to get a handle on in the best of circumstances. However, instead of making it easier for them, the outgoing Trump administration is making it more difficult. The Trump-appointed GSA administrator is refusing to certify the election, which would allow the Biden transition team to begin the long and difficult process of working with the various agencies like the CDC and the FDA and HHS and other agencies to tackle the coronavirus on day one. That process cannot begin in earnest until it gets the green light from the GSA. So that's why we are joined today by experts who have been through these kinds of transitions before. They're going to be able to drill down on what exactly this means. But I want to be really clear about what the stakes are by what the Trump administration is doing by sabotaging the Biden team's preparation in the middle of a pandemic. Every moment that is wasted will lead to more Americans needlessly getting sick and more Americans needlessly going to die. And with that, I'd like to turn it over to Secretary Sibelius.
Well, thanks, Zach, for helping to organize this call. And thank you, Leslie, for the incredible leadership of Protect Our Care. I'm delighted to join former Cabinet Secretary David Shulkin and talk about how a transition should run in normal times. And these are anything but normal times. 10 weeks from tomorrow is the inauguration. 10 weeks, that's not a very long period of time. And it is the time that is spent by thoughtful, careful people to make sure that they have the best possible people to lead these very important federal agencies, that they look at departments and see where the missing pieces are and who they can recruit back to government, sort through what are likely to be thousands of applications and make a plan for the first days of an administration. That's in normal times. These are, as Zach just said, not normal times at all. We are in the midst of a crisis. And what we know is every lost day is a lost life and a lost livelihood. Joe Biden has said over and over again, tackling this virus, getting a handle on the virus is the only way we get the economy back on track and save lives at the same time. So every day wasted is a life that is also unfortunately wasted. So here's what absolutely needs to happen immediately. The election needs to be certified by the GSA to give the Biden transition team access to have key conversations. What within HHS is still in place? There's a very small number of political appointees over these very critical agencies. The Food and Drug Administration, the Centers for Disease Control and Protection, the backbone of public health. What are those agencies missing right now? What are the conversations that need to happen? What is the expertise needed so governors can begin to prepare for a vaccination campaign? What should be in place right now? Joe Biden and Kamala Harris yesterday introduced to the country a very highly credentialed coronavirus task force, and they will begin to make strong recommendations to the American public. They'll begin to work on logistics, but it can't happen without a dialogue. I was in an administration that dealt with both an economic crisis. The 08-09 crisis was something that Barack Obama inherited, and then we had a pandemic on top of it. I know how complicated this is and how difficult it is. I can't imagine what it would be like to try and deal with that when you have a hostile takeover, if you will, a government who will not share information, give access to offices and personnel, and allow the peaceful transition. I would just finally say that I think Senator Mitch McConnell continues to disappoint the American public. He has presented a false choice, somehow that Donald Trump has a right to pursue all legal options. I would agree with that. But that doesn't mean that you deny the inevitability that Joe Biden will be sworn in as president. It isn't either or. Donald Trump can pursue his legal options, but right now the transition has got to take place, and lives are being lost every day. More livelihoods are being lost, and we need a plan, and we need a president who can get to work making that plan. 10 weeks is a very short period of time.
Thank you, Secretary. Secretary Shulkin.
Well, thank you very much. And I think Secretary Sebelius's comments are really important. I would just like to add that the time of transition is really one of the most vulnerable times for our nation. I'm not sure most people realize that on January 20th at noon, 4,000 of the people who have led our agencies, who have run our government, leave their office. And over a period of weeks to months, 4,000 new appointees come in, many of them who don't know their agencies, and 1,250 of them who require confirmation by the US Senate. And so this is a very difficult time. And the importance of this transition time is to assure continuity of government and continuity of government services. And as Secretary Sibelius said, under normal circumstances, this is really important to do well to assure that. But during a time of a pandemic, during a time of crisis, this is critically important. And that's why having a successful and comprehensive aligned transition effort is so vital to the results of and to the impact of so many American citizens. It really is about their lives. And this is where leadership is critical. You have to have a chief executive. You have to have the president who's fully committed to making this transition successful. And it really takes having parties on both sides willing to work together, putting aside any political interests to really put the interests of the American people first. I happen to be part of this. I was in the Obama administration when President Trump won the election. We had prepared our transition documents and our ability to transfer information to the incoming Trump team very seriously. President Obama told us that he wanted this done extraordinarily well. He himself had appreciated how President Bush had taken that transition so seriously and wanted us to do it even better. The Trump team that came in when I was at the Department of Veteran Affairs, frankly, wasn't interested in the transition documents that we had prepared, didn't want to speak to the political appointees from the Obama administration. I, of course, ended up staying on in the Trump administration as secretary, so I was able to see that transition. And certainly I understand that my knowledge of the agency allowed for the continuity of services, but this is a really important issue to do well. Now, with the GSA not allowing this transition to proceed, we are losing vital time. And even more important, a commitment from the Trump administration and the incoming Biden administration to work together and to put those any differences aside, as Secretary Sebelius said, there can be legal challenges that continue. What we can allow to be problematic is this transition from occurring, because this is serious from a national security issue. This is serious from the health issue that we're facing right now, which, as Zach very correctly said, is really a major concern and growing out of control. So I would just urge the Trump administration to start to provide full cooperation. I would urge the GSA to move forward, to allow this transition to progress. And I know that the agencies are going to take their responsibility seriously to prepare these transition documents and to welcome the incoming Biden team so that we can do the business of the American people and address this pandemic that is really taking over our country. So I appreciate the opportunity to make these comments. Thank you.
Thank you, Mr. Secretary. Leslie.
Thank you, Zach. And I want to thank both Secretary Sebelius and Secretary Shulkin for what they did while they were in office and for the tireless work they put in every day to keep America strong and America safe. In 2016, I was tasked, as Zach said, I was the head of the Hillary Clinton transition for the Department of Health and Human Services. And I had worked as a senior counselor to the secretary, and I was going back into my old office to help lead that transition. But I still was accompanied by 23 highly trained and credentialed lawyers, public health experts, doctors, whose job it was to fan themselves across that department and learn the details of what was happening. And that was critical for us to have a smooth transition of power, and more importantly, to protect the American people and their health. And at a time of a pandemic, this is so much more important. Everyone on this call has explained what's at stake. But let me talk a little bit about what the business of protecting the American public is like. We need to distribute hundreds of millions of doses of vaccines as quickly as possible. The incoming president's team needs to know the status of each and every one of those. It needs to know the details of the plans for how it's going to be distributed. You don't get that from reading the newspapers. You can't get that in the public domain. If you're trying to replenish the stockpile, so every doctor, every frontline healthcare worker, every nurse, every essential worker has the protective equipment they need to do their job and survive and go home to their family, you need to know exactly what that supply chain looks like. If you want to use the Defense Production Act in order to make those materials here in America and get them, you need to know every nook and cranny of how that works. What phone calls have been made? What phone calls do you need to be made? And so every day matters. And every day that the Biden team can't do that hard work means more suffering for the American people. So make no mistake, this has consequences. And the president's continual acting out of his own grievance politics, his failure to recognize this electoral reality, is going to hurt Americans at a time when in this last election, COVID and the economy defeated Donald Trump and put Joe Biden into the presidency, because Americans knew whether the economy was their primary issue or COVID was their primary issue, they were inextricably linked. And that the only way we were going to get people back to work was when they felt safe from this virus. And so no matter which side of that election you were on, there is now an outcome, and there was actually a shared goal. And that was to protect America from this virus. And the failure of the GSA to take this very simple step of allowing the transition to continue means that America is at greater and great risk. Thank you, Zach.
Thank you, Leslie. With that, we'd like to open this up for questions from members of the media. In order to ask a question, if you would go and raise your hand, and then we can unmute the line. That's the way to do that as you go into the